Like actor Chadwick Boseman, our next guest was diagnosed in her late 30s with colon cancer. That's young and for many unexpected. Dr. Eric Askenazi, colorectal surgeon with UT Physicians, along with his patient Angela, discuss how listening to your body and a colonoscopy can be the beginning of saving your life. Dr. Askenazi, I think sometimes people find comfort in saying things like, oh no, I'm way too young for that. But what we saw with Chadwick Boseman is that he was much younger than we usually say someone should get checked for colon cancer. So at what time should we get checked? And obviously, if we know that something's going on before that age recommendation, we need to come in.
Right. So typically, the recommendations are 45 to 50 years old. So it seems to be occurring more frequently in younger people, or the incidence is increasing in younger populations. Therefore, more societies are recommending 45 years old. But that's if you're without symptoms. If you start developing symptoms that persist despite local topical therapy or kind of over-the-counter stuff, or stuff that some creams you can get from your doctor, then you need to be screened earlier. So if you're 25 and you have persistent issues, you need to get screened. So I think there may be a miscommunication or misunderstanding regarding when you should get screened. It's not 45 regardless of your symptoms. It's 45 for everybody, and then for those that have symptoms earlier.
All right. Angela, you were 39 when you were diagnosed. What brought you in, and were you shocked when you heard what that diagnosis was?
Definitely. I had rectal bleeding maybe for about a year and a half. And I was always just told had hemorrhoids, so I would use hemorrhoid medication. It seemed to work, so I never thought anything different. One day, my husband made a comment that one of his friends might have colon cancer because she bleeds when she uses the restroom. So I just thought, what if? And I made me an appointment for a GI doctor. And she told me I needed to do a colonoscopy right away. And that's when they found my tumor.
Wow. Okay. So that's one of the symptoms. Dr. Askenazi, what are some of the other symptoms that people should pay attention to?
Changing your bowel movements, or the caliber of your bowel movements. It's classically described as having pencil-thin stools, or it's stringy stools, as opposed to what you normally have. Weight loss, unintended weight loss for sure, rectal bleeding, decreased energy. These are the kind of classic signs of colon cancer. The problem with this is most of the time these signs don't occur until further along in the course, which is why screening really is important. And if you do have rectal bleeding, which is one of the earlier signs many times, get screened.
Yes. Angela, a lot of times we say family history, family history. Did you have any family history?
Yes, ma'am, I did. My grandpa. But when they did my genetics test at my oncologist office, I didn't inherit it from him. So it was just... it just happened to me like that. It wasn't any family history then.
Yeah, Dr. Askenazi, family history certainly does play a role, but we don't want people to think that if it's not in your family that you cannot have it.
That's correct. Yeah, so about 70-ish% of patients that develop colon cancer, we call them de novo, or they're new colon cancer. They're not genetically associated, or there's no significant family history that you would say, oh yeah, that person has colon cancer because mom, dad, whatever family had it. So the majority of colon cancers are new colon cancers, and it's probably secondary to the amount of times these cells internally replicate. So we have to, we eat the typical diet, and the cells are exposed to everything we eat because they're on the inner lining of our intestines. So they have to be replicated and duplicate all the time in order to be able to maintain good intestinal function. So they're turning over all the time, and sometimes during those replications, an error occurs, and sometimes that error is a carcinogenic or a cancer-producing type of error.
All right, so from the rectum all the way through the entire colon, there's a lot of real estate there, and one of the most effective ways to figure out what's going on before it can even become cancerous is your colonoscopy.
That is absolutely correct.
So when I had mine done, there were no polyps. They said, okay, you're good for 10 years. But if somebody finds that they have polyps, that's what you're looking for to remove, right?
Right. So the purpose of the colonoscopy, a lot of people make comments on, well, I can just do a CT that'll show me if there's any new fancier techniques, basically, to be able to define polyps or non-polyps. And that's all great. But if you find something, then you still have to do the colonoscopy to get the polyp removed. Right. So you might as well just do the colonoscopy in the first place, because if you see something there, the vast majority of the time you can address it with the colonoscope and then you go home and you're done. It's one and done, rather than, well, one and then there's potential 2 or 3 other tests afterwards. That's just too much time, frankly.
Yeah, and Angela, you had metastatic rectal cancer, and so your treatment course was different. What did you have to go through?
I did 15 rounds of chemo, 15 rounds of chemo, and then I had to do Dr. Askenazi removed my rectum, and I had a ileostomy bag for like 6 months, and I did a reversal, and now to this day I'm blessed. I did a scan yesterday, and it's still all clear. I have lesions on my liver, which are not non-active, so they're just sitting there. So basically, I have to do scans every 3 to 4 months as we speak.
Yeah. Good news. All right, Dr. Askenazi, again, a lot of younger people, when they go in, what happens is they say, oh, that must be, since you're not old enough, that must be just, some other things that we can just give you some medication for. Points to the importance of what you were talking about, getting in early to avoid having to do the more severe treatments later. And again, this is one of those cancers that we can actually pretty much avoid.
Yeah, if people actually got screened appropriately, Angela is a different story because she presented quite young. But the majority of the people that we see are not 37 by God's grace. They're 45, 50, 60, 70 years old. If you get yourself screened, you can truly avoid the majority of colon cancers, which would be a fantastic thing, considering that 1 in 20 or 1 in 25 people during their lifetime will get colon cancer. So if we could avoid that, that would be amazing. But that being said, because we're starting to see the incidence increasing in younger people, I mean, sometimes you have a 22-year-old that comes in with colon cancer, and you're like, this is unbelievable. This is a disease of 60 to 70-year-old people. Why is a 20-something-year-old getting it? And it's not genetically affiliated that we can see. So if you start developing symptoms, get screened.
All right. You and Angela are wearing the same shirt. Angela, you have become an advocate to make sure that people could do what it is that they can to prevent this. So tell me what your shirt means.
Check your colon. It basically means why I wear it is so you're never too young to check it. I just tell everybody, if you have signs, don't ignore them. Listen to your body. Basically, that's what this shirt stands for.
All right. There are a lot of cancers that we just don't know and can't control. This is one that we have a lot more control over. Love your shirt, Dr. Askenazi. So thank you very much for giving us this information that can be life-saving for so many people.
Yes, ma'am.
Thank you.
And for more information on UT Physicians and to book an appointment, call 888-4UT-DOCS. That works out to be 888-488-3627, or visit utphysicians.com.